Hello, everyone. Welcome. All right. So, if you are here live, please just let me know in the chat that you can hear me. If you can just confirm that you're here and can hear me okay, because I did change the mic settings. So, I just want to double check that. But welcome. Today, we are talking about politics. And so many of you have been letting me know that your sessions have been dominated by this topic the last few weeks, both, and regardless of how you feel or the clients feel, but just that this has been the overriding topic by far. And so we're going to go a little bit beyond like, how does this relate to treatment goals and trying to make it work with that kind of thing, and just talk about how do you manage discussions that are very charged and that you might be concerned about communicating too much about what the client is saying. So, all right, if you are here live, let me know that you can hear me okay. If someone could just put in the chat, even just a thumbs up or something. If you are watching the recording, welcome. My name is Dr. Maelisa McCaffrey, founder of QA Prep, author of the new book, Stress-Free Documentation for Mental Health Therapists. And I am here today to clear up a few things about how do you document having these conversations. So, and thank you everyone for sharing that you can hear me. Okay, so do you document? Let's start off with, do you document having these conversations? I would say it really depends on what is the overriding topic. So my advice here is not going to change drastically from what I always say about anything related to progress notes, but we are going to talk about this topic very specifically, and I will give you some specific examples. So do you even document it? As always, my answer to every question is it depends. So if it was a 5-minute conversation and most of your conversation that day was actually about the person's work stress or their communication problems with their partner, but that is not related, then no, I wouldn't even mention it. There's no, just like if they came in and talked about a party they went to over the weekend, but that was only 5 minutes and not really related to what you're actually working on and not related to the majority of what the session was about, then no, I wouldn't mention it at all. But I would use that lens. It's not about the fact that it's political. It's about the fact that it was kind of irrelevant to the overall session as a whole. So that's your first guiding principle. It's like, what was the overall session? Now, a lot of people, especially during election week, but I would imagine still, and this might happen again in January when we switch presidents because or switch representatives or whatever it is that might have been concerning about to your client or that your client might have been talking about. So regardless of how they feel politically, it's likely to come up again when that happens. A lot of you have been telling me that actually it is the sole focus of your session. It is the entirety of the session. So so that's when people are reaching out, like, how can I not document it? What do I document? So let's say it is the majority of your session. And even if it's, half the session, but it feels like it's the majority of the stressor, that could be relevant, right? So if it feels relevant to talk about, meaning it was the big focus of your session, or even if it was a focus of the session and it's somehow directly related to the treatment goals, then yes, I would address it. How do you document it? Very practically, keep it super basic and vague. So here you want to think about, keep it simple. Just keep it simple. There is no need to say the word Democrat or Republican or independent or whatever. There is no need to call out specific other people, like the actual president now or the president that will be. However, you could use more general terms like politics, election results. All of those can, you can use those phrases. So it might be like something like discuss emotions around the election. That gives plenty of detail. That one phrase, client was distraught about the election. That doesn't necessarily say what their political beliefs are. You didn't say presidency. You didn't say what specific election. You can say client discussed their emotions around the election. Client discussed their feelings about the election. We could go on and on with that. Or the other thing that might come up with people is like their conflict. So I'm thinking now it is the day before Thanksgiving here in the United States. And I know that a lot of people, according to surveys, are planning to like ban talking about politics at family events. But this is another thing that can come up, right? Where maybe your client has different political views than a lot of their family members. And so in session, they're talking to you about being concerned, about, how to manage the conflict. That is something that it is specific to the election or to their specific politics, but it's also not, right? You are just helping them manage. How do you discuss having different beliefs with your family? How do you manage when your family members make extreme comments or actually make degrading comments about your own political views, right? To me, this is not really any different than how you would discuss having these same discussions with people about religion or something like that. That's also a really common thing, that families come together at these holiday events and they have different views. And that is part of being human and part of being in a family, right? It doesn't mean that anyone is dysfunctional or even wrong. And it is a big part of what we do as therapists, is helping people to manage this conflict, right? Manage this conflict in values, in communication styles, and to manage their own triggers, but also like to regulate their own emotions in these discussions, and to become aware of their feelings and their triggers, and how much they can manage, and to create boundaries and parameters around that, right? I mean, that is, in a nutshell, like a huge part of what many therapists are talking about with clients all the time. And those are all things that I just talked about and are fairly specific, and yet also describe a whole bunch of scenarios, right? That could describe parenting philosophies. That could describe religion. That could describe political beliefs. That could describe cultural beliefs or practices. We could go on and on. And so when you're talking with when your clients are in session talking about struggles around managing that, which I think is also a lot of it. A lot of it is their own emotions, whether that be disappointment with other people, disappointment with how things turned out, disappointment with not being able to celebrate how things turned out, whatever that is. A lot of it is about them in relation to others, right? And so that's the reality of, I think, what we're digging into. We're not just sitting there and, for lack of a better phrase, having a bitch session with a client about politics. We are hopefully moving beyond our own political beliefs, whatever they may be, whether they're the same or different from our client. Hopefully we are not letting our own beliefs and selves get caught up in that story too much, so that instead we can focus on helping the client navigate what they are struggling with. That's our focus, right? Helping them navigate this emotional turmoil that they might be in for whatever reason. That's going to be what you're going to talk about. Those are your interventions. Your interventions are the same. I will link in the below this video. I will link to my therapy interventions list that you can get for free. It's a free handout. All you have to do is click the link, add your email, and we will send that to you. It's really not that different. And you can add, if you want to, political views, election results, various, conflict with partner over political views, conflict with coworkers over political views, conflict with family over political views, right? That's fairly specific, and yet doesn't divulge anything specific about your client and their own beliefs that you might feel uncomfortable. So I hope that helps with giving you some specific examples that you can use that really apply across the board. So remember, these are things that you can use throughout these discussions, as different things happen with your client, I would focus on, what is their experience of what's happening and how are you helping them manage that? And is that more of a internal management, helping them grieve? So are you encouraging them to grieve certain things? Are you encouraging them to, focus on self-care? Are you reviewing coping skills with them? Are you going through communication skills with them about, practicing communication skills when they are talking with other people? Practicing self-care when they are on social media or scrolling through social media? Practicing communication skills on social media? These are all really, really relevant things. So don't worry too much about whether or not to document. Just document what the majority of your session is. And I would say, and if it's very difficult because you're like, but we just sat there and talked about the election, then that's also where I would challenge you on, yes, your client might need an entire session or multiple sessions grieving the results of the election, feeling frustrated about the election, discussing it, talking about how they're going to manage it, worrying about things as a result of it. And are you focused on them and helping them manage that? My guess is that most of you are, right? And also, I think as therapists, many of us in mental health are fairly social justice oriented, and it can be very easy. My cat is going to interrupt this live session. It can be really easy when politics are involved or when different things come in to let our own emotions and our own feelings about things get in the way. And so a lot of it also is, are you managing your own self-care? Are you, and that could mean knowing, God, I know I have different beliefs than this one client that's coming in, and it's going to drive me nuts. And I know that they're going to come in and say X, and I'm going to be thinking Y, and it's going to be really hard for me to manage that. Okay, just as you would with any other client in any other scenario where you have a different belief about something, focus on how you can manage that in that session so that you can stay with that client and help them focus on managing whatever it is that they need to manage. So I do think that the self-care aspect is a huge part of it. I've had so many therapists also telling me that they feel really burnt out and they're really frustrated, and that it's been really heavy. That not just is it having these political discussions be a central focus of almost every session a lot of the time, especially during election week. That was, I think, so many people told me it was literally every session that they had. But also telling me how just heavy and burnt out it feels. And it reminds me of what happened in the first, maybe not even the first month, but definitely the second month of the pandemic, where it felt like everything was really sinking in and a lot of things were starting to feel helpless or hopeless. People felt helpless, and it started to feel like there was very little end in sight. Whereas I think when the pandemic first started, a lot of people had this, okay, we're going to we are all in this together type of mentality. And, for the first couple of weeks that was, and we thought we're all in this together for the next 2 weeks while we all just sit at home. Right. And then it turned into months. And so I really noticed the second month of the pandemic was when a lot of therapist burnout started happening, because your clients' acuity was increasing and you had the same number of clients, and you also had a lot more significant stress in your own life. And so just from, my conversations talking with therapists, because that's my role, is I'm always in a supportive role for you guys. I'm seeing a lot of that same discussion related to the burnout and related to the feelings that therapists are having. So know that you're not alone if you are experiencing that. And I think it's really important not to ignore that. Acknowledge it and make sure that you are prioritizing self-care, because that is really, really critical. And that will help you manage these scenarios without getting too overwhelmed or too stressed. And if you're not managing your own self-care, it's going to be very easy to be overcome by having a bunch of clients who are creating scenarios that require you to think differently about how you document, that require you to, that are making you question how you're writing different things. Here's my cat. And who are, potentially also struggling more than they were. And so when that happens with all of your clients all at once, really your first step has to be improving your self-care. All right, I wanted to, let's see, I'm just checking. Yeah, I think I covered all of my notes that I had there. So hopefully that helps. If we have any live questions, this is the time to make sure you put those in there before my cat starts chewing on my earbuds and then we have to go. Let's see. Yep, and I'm just checking to make sure we don't have any live questions right now. So type them in. Let me know if you're going to be typing one in. But be assured that you don't have to actually share any political beliefs. And it is okay to document that you discussed election results. It is okay to document that you discussed the client's political views. But I would view that as like in relation to whatever stressor, to highlight that it's not that you just sat there and, had a session where you complained about politics together or commiserated about something together. It was a session where you focused on, okay, how is this stressing this client out? How can you help them manage that? Or how can you, even there are times where therapy sessions are more about sitting with and moving through grief. And it can feel a little less active as far as interventions go. And it's still a hugely important part of the relationship and of moving through that with the person. And so you can, talk about that. I will say, I will add one last little caution there is, again, if you find yourself discussing this with clients, having it be the majority of the session, multiple weeks in a row, and you're working with insurance, do make sure that you are still following that treatment plan. And if your treatment plan is about managing someone's anxiety symptoms, if their treatment plan is about managing their anxiety symptoms, and they are anxious about attending Thanksgiving dinner or, a family event with people who have different political beliefs, that's very relevant to your treatment goal. And it's just the political environment and this experience is grist for the mill related to that goal. And so it doesn't necessarily mean that you're straying from the goals. So I would look at that. And if you are, as I always say with treatment goals, that is just a signal to you of either I need to get us back on track because we are, maybe focusing on something that isn't as important or relevant, or I'm letting us get off track from what the goals are, or you revise the treatment plan. That's also really relevant to say, hey, I know we've been talking about this for a few weeks now, and it seems like, based on whatever's going on, whether that's in your life or in the world that's impacting you, it seems like maybe we need to, here is our treatment goal. Is this still what you want to work on? Or should we shift to something different? Do you want us to create a new treatment goal around this new thing, which would be, managing their emotions around this and whatever that person's experience is, knowing that different people have such a vastly different experience. So that's my advice to you, especially if you work with insurance and you're wondering about how does this work with treatment goals and treatment planning. All right, well, we're going to sign off because I don't see any comments. I hope you all have a wonderful Thanksgiving. I will link below in the description of this video, so you might have to click on read more or whatever to read the full description. I will link that therapy interventions list, and I promise you can use that in relation to having these discussions with clients, and then just keep your topics super vague. Political discussion, feelings, emotions around the election, feelings, emotions around politics, or managing conflict or communication with family, coworker, friends, etc. All right. Thanks for being here, everybody. Happy writing.